We are at the Toronto Rock Sports and Wellness Centre here in Oakville, Ontario, and we're going to learn a lot about injuries, what happens when you get them, and how to prevent them. Being joined by a physiotherapist. This is Emily, who is really kind of honing in on this facility and why people should come here, because I didn't know that the general public can come here. I thought it was just for the Toronto Rock athletes.
Yeah, so we do treat all of our athletes as well, but we are open to all athletes, whether you're young, whether you're old, recreational, elite, and we try and approach it from that same sport medicine. So really the care that our rock athletes are getting, general public's getting the same care here.
Okay, now what's the difference between sports medicine and non-sports medicine?
So really it's looking at considering the athlete themselves. So we have athletes coming in with different sports, different needs. We have athletes who may have been exposed to strength and conditioning before, who may not have. So looking at who that athlete is, where they are in their sports career, and what can we do to make sure that they not only have the best experience here, but they get evidence-based care, and they have access to a multidisciplinary team.
So I don't even need to be an athlete to come here.
You don't.
But I'm going to get the same benefits of sports medicine when I come here.
You got it.
Okay, now I know that you guys have already done a full workout today, so we get it that you're tired, but tell us what the girls are working on back here.
Yeah, so Casey and Nora are two of our athletes. They have both undergone ACL surgery. So right now in Canada, we know that there's a general increase in ACL incidence, but the group that we're seeing the biggest increase in risk in are female athletes aged 10 to 19. And we know that there's been a lot of research looking at how do we reduce this risk, but this is also a group that has different needs post-op as well. So we know at 1 year, they're 25% less likely to return to sport. They can report increased stiffness, increased joint laxity, and we know that they tend to demonstrate decreased quad strength at 1 year and have a slightly less performance on functional tests. So we want to make sure when we're coming in that we're considering all of that, we're making sure that they have access to the resources that they need for not only their physical recovery, but their mental recovery as well. So typically they'll see myself as well as our sports psychiatrist, Dr. Edwards.
That is so smart, because that's something that you don't necessarily think about. You think it's really just focused on the injury, but instead of their mental health.
ACL's full body. Usually once they've had surgery, the rehab itself is going to take about 9 to 12 months, and that's a period where they're away from their team, they're away from their friends. Yeah. It can take them out of that social role as well. So we want to make sure that we're really considering all of that in the rehab process.
Yeah. Okay, well, we have so much more to learn coming up. We're at the Rock Sports Medicine and Wellness Center here in Oakville. Make sure you stay with us, because there's so much more coming up on Morning Live. Back at the Toronto Rock Sports Medicine and Wellness Center here in Oakville, talking about athletic performance, talking about athletic injuries, what to do if you have one, and specifically what parents can kind of do to help their children if they do happen to get an injury. So we're back with Emily, a physiotherapist, and we've got Liam here, and Liam has an injury.
He does. So Liam has something called Osgood-Schlatter's, which is probably one of the most common injuries that we do see in adolescent athletes age 18 to 18 years old. Okay. And what it is it's when the patellar tendon, which attaches the quad or the thigh muscle to the shin, starts to get put under additional force. So we know that most athletes, for the most part, will grow out of this by the time they reach adulthood, but in the meantime, it can cause a lot of pain and dysfunction through sport. So we want to just chat a little bit about kind of what the parents can look out for at home and some easy things that they can do. Okay. So we know that this typically presents in boys more often than girls. Okay. And typically we're going to see a slow onset. It's going to come on around the time of a growth spurt or a change in their training. Makes sense. That could be increased volume, a new sport, change in playing surface. We also know it's a little bit more common in sports that have a running component too. And what the athlete's going to report is that they're going to have pain through the bottom portion of their knee, right under the kneecap, and potentially some swelling as well. Okay. So what parents can do is, if they're starting to report that, we can look at first and foremost activity modification. So has there been a new sport? Can we look at introducing them a little bit more gradually to that sport?
Slowing down their schedule.
Yeah, if there's a multi-sport athlete, so like Liam plays lacrosse, baseball, golf, hockey, everything. Looking at...
I feel bad for your parents, Liam.
Looking at if they're having multiple practices or games in one day, can we kind of pick and choose and start to prioritize what they're doing?
That makes sense. Okay, so Liam's going to show us some exercises, right?
So we want to make sure that we're stretching out the quad muscles. So Liam's going to lay onto his back, and he is going to walk his heels up to his hips. Perfect. And then he's going to take his feet really wide to the edges of the mat, and he's going to drop one knee in and one knee out. And I like this one because it's typically tolerated well through the knee, especially if they are having pain. And we're going to get a stretch through the front of the quad. We're also going to get a little bit of hips as well. And he's going to hold that for about 5 to 10 seconds and then flip over to the other side. He's going to flip over to the other side. Good.
He takes direction well.
Exactly. And then the last one that we're going to do, so Liam's going to lay flat on his back again, and he's going to bring one knee up into his chest, and he's going to wrap his arms around. We'll straighten out this knee. And then what he's going to do is try to stretch that heel up to the ceiling. He's going to hold that for about 5 to 10 seconds again, and then he'll drop it down. Good. And then he can repeat.
Yeah, that's definitely a good one for the quad. I do that one too. And
Yeah.
it's like that, you know, it really gives you that, oh yeah, felt that. Felt
How does it feel, Liam? Good. And then the last thing that we can be doing, go ahead and hop up for me, is we can look at adding something like a patellar strap.
Oh, that's smart, yeah.
Which is just a little band that's going to go around Liam's knee. Whoop. Let's see if we can get the Velcro here. And we want to put it, so if this is the most painful part right here, we want to go about 1 finger above. There's a little pad there, and then we just wrap that around the knee.
And that'll help when it's the movement,
with
the movement.
It changes the pull point on that quad tendon. It can give the athlete a little bit of symptom relief through sport.
Okay, well, thanks, Liam. Appreciate you. And coming up, we're going to be talking to one of the doctors that they do have on staff, Dr. Reed, about some of the injuries, some of the practices, and some of the healing processes that they go through here at Toronto Rock. So make sure you stay with us. There's lots more coming up on Morning Live. Okay, here with Dr. Reed, and we are now focusing on Casey's leg, and this is kind of post-surgical. So we've had the surgery. She's only 16, and she's had such a major surgery. This is just like, it blows my mind to know that these kids are going through this. What do they need to do as soon as they get the surgery?
So typically with something like an ACL surgery, it's a long recovery.
Yeah.
So it's not going to be a quick thing. A lot of the time, someone like myself as a sport medicine doctor will see them kind of right after the injury happens, a lot of the time, to help from a diagnostic perspective.
Okay.
And then help get them to the surgeons to get doing things.
Okay.
The biggest thing that I would say that's very important with any kind of injury that we see in young athletes is that we want to get them started on their rehab quickly.
Immediately,
Yes.
yeah.
Even if they're ultimately going to be having surgery, the sooner that we start them on even some of that prehab, the better things are going to be for them after surgery. The more we can help bring down that swelling ahead of time, the more we can help get a little bit of movement going, the better the things are going to be for them in that post-operative period. And then once they've had the surgery, that physiotherapy is equally as important going forwards.
Now, when these kids go home, like, it gives some advice to parents. Like, what are we doing as parents to kind of help to make the transition smoothly?
Yeah, so the biggest thing is making sure that, you know, you've talked with, you know, the surgeon when you see them about things like pain management and that sort of thing. Because that can be an important thing and can be something that's really hard to manage in that time. And your surgeon will usually give you some very good detailed instructions for that as you go. Don't be afraid of it would be the biggest thing I would say.
Okay.
And then, you know, follow the guidance on movement and how quickly you can start. And like I said, just getting that physiotherapy booked as soon as you know your surgery date so that you can get going.
Yeah.
That's the important piece of the puzzle. And then, like I said, too, you know, the second you have something happen in a young athlete of an injury, you know, see someone with a sport background as soon as you can. So here we have access where you can do walk-in appointments with someone like myself.
And it's not just Toronto Rock athletes that can come here, right? This is open general public. Like, you can come in here and get the sports medicine.
You could be 45 playing soccer for fun and get an injury and
Can I be 46 and just walking up the stairs?
Absolutely, you can.
Because let's face it, that's how a lot of injuries happen.
Sometimes it is, yes. I would say I joke a lot. I honestly see almost as many pickleball injuries as I see soccer and lacrosse and rugby.
It's a big sport right now.
It is. It's very popular, and you know, sometimes people go into it and haven't done anything in a while, and it's their reintroduction to activity, which is great. But sometimes that does come with injuries that happen.
Sure.
So yes, anybody, but you know, the sooner you get seen for things, even something as simple as like an ankle sprain, can be really good to make sure that you just have that touch point of seeing somebody with that background. Because sometimes those things can come with longer term,
Totally.
recovery. It can also come with, complications that we sometimes miss out on if we don't get that piece of the puzzle quickly.
Okay, well, coming up, we're going to be talking about some of the other elements that Dr. Reed does on patients, like injections of some kind, cortisone shots and all those types of good things that'll really help manage your pain and your injury. So make sure you stay with us. There's lots more coming up on Morning Live. Dr. Reed has been kind enough to give me a little bit of an ultrasound because that's kind of part of the diagnostic procedures that they do here at the Toronto Rock Wellness Center. Now, what are you seeing? What are you looking for when you do an ultrasound?
Yeah, so there's a lot of different things that we look for. Right now, I'm taking a quick look at your shoulder joint from the back. So I can see the bone here, can see one of the tendons as it comes over. And, there's a lot of different things we can see. We can see, is there any fluid in the joint itself? Is the contour of the bone, nice and even, which you'll lose sometimes with something like arthritis. And then we can also see the integrity of the tendons. So, is there any tearing or any fraying in the tendon, which can happen with age and can cause people a lot of discomfort for sure. And then you also can see injuries to those tendons happen in an acute setting. So, something like a baseball player throwing, that sort of thing.
Right.
Where you can see those things kind of happen and see full tears, acutely occur in those situations. And depending on, the situation, some of those are surgical and some of those aren't. For the ones that aren't, it can be a really good opportunity to do something like an injection, and we do a lot of that here. And the nice thing with the ultrasound is when we have the ultrasound, it helps to make the injections a lot more accurate with where we're going. So it offers a lot more freedom for me in kind of what I can, inject into and around. For something like a knee, we don't need an ultrasound, but if I want to inject around your Achilles tendon or
my neck, maybe, like somewhere that's...
Yeah, I don't do as much with the neck, with the spine, but most of the other joints we can get into, I do a lot of hip joints, which I have to have the ultrasound in order to see, right where the needle's going to. Yeah. And I do a lot of different kinds of injections. So I use things like cortisone.
That was going to be my next question.
Yeah.
Like, when you say injection, what are we being injected with?
So we've got a lot of things. So I'd say the most common one that I do is cortisone. So that's an anti-inflammatory, just to kind of help settle down pain and inflammation. And we'll use that for arthritis and tendon issues and things like that. Another option are the gel or the hyaluronic acid injections. The one we have here is Synvisc. So those can work really, really well for something like arthritis in a knee. Occasionally in a hip and a shoulder, but I'd say most commonly in a knee. And they kind of act like a WD-40 for your knee.
I was going to say, it just kind of like lathers it all up and gets it going a little bit better, right?
Helps lubricate and kind of give a little bit of cushion.
How long does it last for?
Those last for 6 to 12 months when they work.
Wow.
They don't work for everybody, but they do work quite nicely when they do work.
Oh, that's amazing. So you'd really only have to come back once or twice a year.
Exactly. And I have lots of patients that I see, I have lots of my older population who winter in Florida, so I see them in October before they leave, and I see them in April when they come back.
Yeah.
And then the last option that we do is PRP, and we've got our centrifuge there. With that one, we draw your blood, we spin it down in this machine here, and then it separates out your red blood cells from your plasma and gives us the platelet-rich plasma. So we're using your own stuff to inject.
That's cool.
Yeah, and that can be really great for something like a tendon, where sometimes, something like cortisone can weaken the tendon, so we have to be really cautious with it. So it can be really great because it doesn't come with those risks in that setting. So, yeah.
That's very cool.
Yeah.
Okay, now if people want to find out more information, where can they go?
Yeah, absolutely. So we've got some of the information on our website, and ultimately, if you think that you qualify for these things, just make an appointment, come in and see me, and we can talk about, what would be best for you. Different of the injection options work better for different people.
Of course.
And it really just depends. So,
okay.
Yeah,
all right.
absolutely.
Well, thank you so much for having us.
Yeah.
I'm going to clean off my shoulder here, but all this information is going to be on our website as well at chch.com.